When I think direct primary care, I'm thinking on-site clinic. The employer's built a clinic and they want to have uh, that available for their employees to utilize for a convenience option, I guess, for them versus having to leave work, go to a clinic, and come back to work, right?
Mhm.
But with that, there's incurred cost, right? You have to designate an area, you have to do build out, you have to then buy medical equipment for the clinic, you have to pay to staff the clinic. So
Mhm.
is that direct primary care, or is direct primary care, can it also be something else such as a virtual experience that
Sure.
an employer and their employees could utilize?
Direct primary care now has really changed its look, and that was the initial look was that on-site clinic. Through the COVID pandemic, we did see a lot more virtual care happen within health systems, and that absolutely is the beginning of the spectrum of healthcare on site. So employers now can offer virtual care. It could be for example, Care My Way, or it could be Care My Way at work, where you actually have ancillary equipment that helps with that visit. You also may incur that we have mobile services. So a clinic now may drive up to your employer location and actually provide services however frequent you may need it for your employee base. These additional types of clinics added on to those direct locations or the on-site clinics that are built out in our employer partners, these additional services have really created some convenience for the employer and some reduction in cost in providing that access to healthcare.
I'm glad you touched on that because I think the reduction in cost is probably one of the biggest things, right? I mean, convenience, very, very important. Being able to seek care virtually, right? Benefits me as an employee not having to leave work, benefits the employer because I'm not leaving work. But
Correct.
then it's that whole cost issue of now me, if I put myself in the employer's shoes, I don't have to build the clinic. You talked about Care My Way at work. We actually provide the equipment that the employer can use. All they have to do then is designate a room where the patient can have the provider encounter, but then that's it. There's no build out. They don't have to buy the equipment, et cetera, correct?
That is correct. And also the same with the mobile primary care. Um, type of service, because what this actually has is a mobile unit that has an exam room, access to, in the future, it's going to have lab, but it really is a exam room that drives up to the location, and employees come out of the building and go into the exam room. We have heard and listened to our employer partners who have said, we just don't have the space to be able to build this out. Every square footage of a building is so important to those either manufacturers or other facilities to utilize in growing their business. And so this way they can have access to healthcare without having that expenditure. It really is a great way to bring healthcare to employees at the employee location.